talk is about why you should use Telehomecare for your patients. This is me 2 years ago, a family physician in Brampton, Ontario. Like many of you, I was suffering from stress, burnout, and feeling overwhelmed. And like many of you, I was hoping that my EMR system would solve my problems. But unfortunately, it didn't. Mostly because our EMR systems were built to solve yesterday's problems, not the problems of today's world. This was a research study published in the Canadian Family Physician a few years ago. They interviewed physicians and uncovered some startling facts. 47% of physicians were suffering from emotional exhaustion and depersonalization. A huge proportion, I would say. So why is this happening? There are a number of factors. The knowledge explosion, new medication, treatments, guidelines, which is impossible to keep up with. There's the ever-increasing complexity of care for our patients. The new mantra of pay for performance. Our new responsibilities administrating our practices, staff, and other healthcare providers. The emphasis on building communication skills, and our new central role in the coordination of care of our patients. On top of this is the ever-facing reality of the aging of our patients and the effects of that fact on our work. This interesting study, published in Preventing Chronic Disease, examined the time for a physician to provide acute, chronic, and preventative care to his or her patients. And what they found was that it would take 21.7 hours per day. Yes, 21.7 hours out of 24 hours, which I'm sure you would agree is pretty much impossible. So faced with these realities, stressed out docs, with a number of pressures placed on them and an increasing workload, what is the solution? I would argue it requires a new way of thinking about how we organize and provide care to our patients, especially those complex patients who require it most. Let me give you the example of Mr. Islam Muhammad to illustrate this issue. Mr. Muhammad has CHF, chronic renal disease, and diabetes. He lives with his wife in a senior's apartment and has visited the ER quite a few times in the past year. His last admission, his dose of Lasix was changed by the hospitalist. But you didn't find out until he was already home a week after he was discharged. Now you are scrambling to fit him in for a home visit or get him into the office. But while you are doing this, he again goes to the ER with a new CHF exacerbation. Needless to say, this patient suffers what could have been prevented with the plan of care after his discharge. Care of our patients, especially those with multiple comorbidities like CHF and COPD, require a coordinated approach to support us if we're going to provide care to them. So what is the role of technology? I would say that the changes in technology are a great enabler of this new way of providing care. But first, let me take you back. Here is a medicine man, still practicing today the way medicine or healing was practiced for thousands of years. This knowledge of treatment was passed down from generation to generation, father to son, and this medical man, sometimes a woman, would travel from village to village treating people with their knowledge of healing. Fast forward to 600 years ago, with the invention of the printing press, and knowledge starts to expand dramatically from a few people to elites of the world. This gives rise to the first universities and education of the first physicians and surgeons. But still, the knowledge of medicine is held by relatively few people, though made wider by the technology of print, telephone, and radio. By 30 years ago, we have physicians like this working community practices providing care to their patients. Then comes the explosion of the internet about 15 years ago. Knowledge becomes easier and easier to distribute to each other. The circle of care widens around the patient, enabling teams to now provide care to the patient. With the rise of social media platforms, patients are moving to the center of this widened circle of knowledge. We are now in an age of networked intelligence that is the direct result of the changes in technology and its effects on how information can be shared effortlessly. How does this new age of networked intelligence impact our patients with chronic disease? I believe it enables us to work in teams, share the care of these patients, and allow for innovative ways of providing care, all buttressed by these new principles of this age: openness, collaboration, interdependence, and sharing. One of these innovative ways is Telehomecare. Telehomecare is a program that provides remote monitoring of your patients with CHF and COPD by a nurse with coaching and education of your patient so they can learn to manage their condition better. What is the evidence for this, you may ask? This article in Health Affairs looked at the 6 features of Medicare that cut hospital admissions for high-risk patients. And they found these 6 themes: supplementary phone calls to patients, occasionally meeting in person, acting as a communication hub, delivering evidence-based education, providing strong medication management, and providing transitional care. All of these features are present in Telehomecare.
The goal of the Telehomecare program is essentially to empower patients to take control of their own health and take control of their life and have a better quality of life.
Patients have a new partner in healthcare. Telehomecare uses simple, home-based technology to monitor key health indicators and help patients better manage COPD or heart failure. It keeps patients connected in their own homes.
We are addressing 2 chronic diseases that probably are in the top 5 of the list of chronic ailments that affect patients and cause them to actually require a lot of tertiary care services, meaning emergency room visits, inpatient admissions, specialized clinic appointments. The patient is managing their care. They're preventing those exacerbations of their illness.
It's like a proactive approach. I know the medications that I have to take and why I'm taking them. And it gets me on a schedule. I've been in hospital since 2011, 4 times at least. Once I was on life support for 3 days. Another time my heart went out of rhythm, so I got paddles put on me a couple of times. And that was through getting there later rather than sooner. So having this in place, I can turn that around to sooner rather than later and avoid all that unnecessary angst that I put on my family. I had the easy part. I just slept through it. They had to look at me.
We do health coaching sessions based on what they've identified as gaps in their knowledge about their health. Patients love the program and they love being able to see their vitals and monitor their health at home. And many of the patients that have neared the end of the program and are ready for discharge have purchased or looked into buying equipment on their own because they're able to continue to monitor their health at home.
Programs like Telehomecare really demonstrate the way we can use technology to improve the care we provide our patients. We're then utilizing our healthcare dollar more effectively. I think we need to, as primary care physicians, embrace that. Patients are ready for it. I think we need to be ready for it. This is quality care.
I would certainly recommend Telehomecare to others. I can't see why anyone wouldn't want to try it. It was so simple, so enjoyable to learn. I'd rather do this than leave it to chance. And it's my life I'm dealing with. And I said earlier, I'm looking for just a little longevity.
It's
a no-brainer.
Telehomecare. Better health at home.
Let me give you the experience I had of one of my patients in the Telehomecare program. Mrs. B suffers from COPD. After she was rushed to the ER and admitted for a COPD exacerbation, I referred her to the Telehomecare program. She has done remarkably well, except for an episode where she developed new onset of cough and fever. Luckily, the Telehomecare nurse was right on top of it and contacted me right away. I prescribed antibiotics over the phone and helped save Mrs. B from getting worse and having to go to the ER and probably being admitted. Apart from the patients who are benefiting, there's preliminary evidence from my hospital in Brampton, William Osler Health System. What is showed was that ER visits have decreased by about 50% and admissions by 25% for patients enrolled in the Telehomecare program. This is remarkable. So, how do you make a referral? It's easy. Just fill out the form, and even easier, pull up a list of patients with CHF or COPD from your EMR and send it to your Telehomecare program. They'll call all the patients and assess their suitability for enrollment. In our age of networked intelligence, defined by collaboration, interdependence, sharing, and openness, the Telehomecare program provides you support to provide comprehensive and effective care to your patients that need it most. And that makes me happy.